Welcome back, everybody. Welcome to the Eyecare Experts. I'm Dr. Bell with Dr. Terrezza, and we have with us today Dr. Martin for the first time, I believe, joining our podcast. So welcome.
Thank you.
Tell us a little bit. I know the viewers and the listeners and anybody watching and clicking right now on YouTube and any other channels, tell us a little bit about your background, you know, how you went into becoming an optometrist and all that stuff.
Okay. Yeah, well, like he said, I'm Dr. Martin. I'm originally from Ohio. That's where I grew up. And how I kind of got into optometry is I actually had a science teacher in high school who said, you know, you're pretty good at science. Would you maybe consider going into the medical field? And so I shadowed a few eye doctors, and I really liked the optometrists the most. And I shadowed a few other doctors too, but I just really liked the eye care. Nice. So that's kind of how I went down that path. But then I went to college at Washington and Jefferson, which is in Pittsburgh, Pennsylvania. And then I went to PCO or Salis for optometry school, which is in Philadelphia. And then I did an ocular disease residency at the Baltimore VA in Baltimore. Lived there for a couple years and then moved here.
Yeah, we're certainly glad you did, and welcome, and glad to have you certainly on board. Pensacola, from Baltimore to Pensacola?
Yeah.
Well, yeah. Her husband's in the Navy. She's forgetting him, of course.
I guess we can mention that's why I'm in Pensacola.
So we'll take her for as long as we can have her. We'll take
That's
her.
right. Well, you never know.
Yeah.
She might even decide to stay. You know what I mean?
Right.
That's right. Pensacola's a great city.
We like it so far, so.
Well, today's topic we're going to go through is getting about that time of year. We're getting Halloween, makeup, and eye safety, things that could possibly happen with certain costumes or just in general, going out for parties and anything along that. But I can't believe we're already to Halloween. And it's amazing this year's flying by.
Yeah.
It's almost gone.
So let's just start with, I guess the one thing we certainly think of for us is contact lenses. I guess the warning we would give for someone who's just going and maybe buying over-the-counter contacts from somewhere that you can't get a prescription for, things to look for or be cautious of, that sort of thing.
Yeah. Well, I definitely feel like there are places where you can buy contacts that aren't FDA approved, and which means that they haven't been tested to make sure that they're clean and safe and fitting well. So I would avoid anything like that. The best thing to do is to go to your eye care provider, and you can be fitted with lenses, and like we have colored contacts that you can do for Halloween costumes, things like that. And that's definitely the safest way to go about it.
And I would say, even if you have, let's say you found a pair of contact lenses you like that's online or something like that, when we see you for the exam, we're going to check the fit, we're going to get the base curve, we're going to make sure you get the right lens that's going to work best for your eyes. I say this to a lot of patients, if one lens worked for everybody, we just have maybe one contact lens in the back room. And being that we have 20 or 30 different types and varieties is because we have different tear films, we have different makeups, we have different measurements on the eye, and so all that plays a real importance in getting you fit to make sure you don't have any health problems per se. So come in for the eye exam. We're going to give you a prescription. If you have another lens, you don't have to order it through us. We just want to make sure that you're taken care of and make sure certainly you have fun, but also you don't have any effects that will last after Halloween night that lasts for days or weeks after that.
We also have Halloween specific lenses. So we have all kinds of shapes, 8 balls and things that people put on their eye that make them look bizarre, but they like that. We also have all the major colleges and their logos on the lenses. So people, for instance, it's pretty scary, they wear Auburn University lenses. And it's just for the fact that Troy and I both went to Alabama, but
So
that happens to be the case. But if they wanted Alabama on the front of those lenses, we do those also. So the idea that you can't get stuff through the normal channels is incorrect, and you're taking risk when you do it other ways, and you only get one set of eyes.
Mm-hmm. Well, just taking a step back, if you're going to any convenience store or supermarket, and you're just buying lenses that are behind the desk, those are not FDA approved, and you're taking a risk, a big risk, and you could have major issues with that. So be aware. I mean, they are, even if they have 0 prescription, which Halloween lenses would probably be plano, no prescription at all, they're still a medical device. You still can have issues wearing those contacts. So just buyer beware, you know, come in and see us. Plus there's things with the eye that you may not be a great candidate. You could have something going on where, hey, contact lenses might make it worse.
That's right.
And during that exam, we would find that out and say, hey, you know, be careful, or this may work better for you.
Yeah, bacteria is not going to differentiate whether you have a prescription there or not. It sees a good place to eat and grow. It sticks on the lens and chews stuff in your tear film and on the front of your eye. So it's a dumb move.
And that's the other good thing about coming in to get fit is we'll teach you how to put them in, how to take them out, how to safely use them so that you don't get an infection or an abrasion or something. So.
And I've had, you know, thinking of that, I've had patients in the past who came in just for, hey, I just want something to wear for a party. And they're like, man, these are nice. And then afterwards say, hey, I'd like maybe get a prescription in these. And that kind of turned into, hey, I don't want to wear my glasses all the time because these things are more comfortable than I thought they would be. So there's always that, but you know, certainly come in and see us. We want to see you, we want to work you in, we want to get that exam and make sure you're fit and make sure everything's taken care of.
Well, technology has impacted the contact lens field like everything else. Before, when it first started, there was one company that made these lenses. There's probably 25 or 30 families of lenses from just one company today. There's 4 major manufacturers, so if you do the math on this, 25, 30 per company times 4 or 5 companies, and you get a large variation on what's available for you.
Yeah, I have definitely seen patients that haven't done contact lenses in years, but they might want to try again. And when I put them in a newer lens with newer technology, and they're like, oh, wow, this is a lot better than I even remember. And they kind of want to start wearing them again. So.
Yeah, they were in a flip phone, and you put them in a smartphone. Yeah.
It's hard to go back to the flip phone once you use a smartphone.
Right.
Well, you know, we're talking specifically today about Halloween, but there's so many other uses. I mean, we have patients that are born with anuridia, with certain congenital conditions. Maybe they had trauma to the eye, and we fit them with special order lenses to take care of that condition. So, you know, we're talking about Halloween, but there's a lot of specialty contacts. There's a lot of usage for contacts besides just seeing better. You know, if someone's pupil is 3 times as big as it needs to be, you can imagine how much light's going to be going through the eye, and we can fit a contact lens to black out some of that, so it makes it, you know, more manageable when the patients are outside, so they don't have to keep the eye closed or the glare is really bad. So there's a lot of other usage, and there's so many, to your point, there's so many reps, so many contact lenses, there's so many manufacturers, there's a lot of things we can use them for.
I agree. You know, Johnson & Johnson, a major manufacturer of contact lenses, they make the Oasis brand, and this next year they'll be coming out with a lens that will elute, which is a fancy way of saying they'll drip the drug out, but the drug will be included. Particularly, their first one's going to be an allergy drop. So you put the lens in, you wear your contact all day, and this will let a pre-prescribed amount of that drug come out and leak it out all day. And so you'll keep your allergies under control. So there's a lot to this game.
Well, you know, besides contacts, certainly masks, face, makeup, the thing that comes to my mind, I guess, first and foremost, is what I see quite a bit of is things leaking into the eye, you know, whether it be special eyelashes, maybe a mask over the eyes, and certainly you can have a strong allergic reaction to some of those chemicals if it's leaking down into the eye or the eyelid sort of thing. So you just want to be careful about what you're putting around the eye, and certainly if you're sweating or if it leaks as the night goes on, that certainly could hurt the eyes, cause redness or cause an infection or just have an allergic response.
Some of those chemicals are strange and scary enough in themselves. The components range from what they call PFAS, perfluoroalkyl AS. Alkyl, I forgot the last part of it. I wanted to say, alkyl benzoins, okay? So benzyl chemicals, and they're called forever chemicals because they don't, the earliest half-time for those things to dissolve is 100 years. So you're putting this stuff into your eye or around it, it gets absorbed by the skin. You got to be careful with this. And so if you have a lens that has a higher absorption rate than normal, it'll absorb that into the lens and it goes into your system. Not the best thing to have.
Another one I've seen to be careful about is eyelash glue. I've seen some people that didn't realize that they were allergic to the eyelash glue until they put it on. Sure. And you know, some people do fine with it, but I think with eyelash glue or any other kind of makeup, you definitely want to kind of test it on your skin first to make sure you're not allergic to it. And I think there's also been instances where people kind of can accidentally glue their eyes to their eyelids if they use the wrong stuff. So definitely be cautious and test, you know, those kind of things before you put it around the eye.
So if that were to happen, let's just say it did happen, you know, we don't want it to happen, but it happened. You know, we would encourage, you know, saline to kind of flush the eye to get some of that out of there as much as you can. And I usually say, you know, if it's still red, it's still hurting you, you know, within a day or so afterwards, come in for an eye exam, office visit, because sometimes, you know, it can get worse and we want to get that better. Maybe it is just allergic. Maybe you had a corneal abrasion. Maybe the glue, you know, stuck to the eye and you don't know you have a corneal abrasion, but it's hurting a lot, you're light sensitive. And so we want to get and find out exactly what's causing your issues. That way we can treat and get you prescribed the right medication.
Yeah, sure.
I agree. The idea of any kind of a problem with the eye, you want to hit it when it's a little campfire and you can put it out with a garden hose, as opposed to blowing into a 3-alarm fire that you'll then have to be seen by a specialist or at some hospital facility. We'd like to keep those to a minimum.
Yeah.
Well, the cornea itself, which is the front of the eye, has a lot of nerve endings. So if you have an abrasion, you have something that scratches that surface, let's say you have maybe an ulcer, you know, because of contact lenses related issues or something, it's painful. I mean, it hurts. You're light sensitive, it's tearing. There's a lot of things that go with that. So don't think, hey, it's just a red eye, it's going to go away in a couple days. To your point, it's only going to get worse, and then it's going to be harder to go back and correct it and get you feeling better, and it has the potential to leave a permanent scar in the eye. So anything like that, we want to catch it as soon as we can. Not only get you feeling better, but also usually a better outcome. Anything else on the glue or makeup or anything we didn't say? Or
The only other thing I can think of, we've sort of already said this, but kind of goes back to the contacts and what you were just saying. If you're buying something that you weren't fitted for and you put it on the eye and it feels uncomfortable, it just doesn't feel right, that's probably a sign that it's not. So I would say anything that doesn't feel comfortable, you should take it out. Don't try to just tough it out and, I'll wear it for my costume and then it'll be okay, because it's probably not doing any benefits for you. So if it doesn't feel right, it's probably not.
Costumes have gotten so advanced nowadays. I just remember as a kid, when I was a kid, you had the old plastic mask and you had the rubber band. The rubber band would last maybe a couple of households, and then the rubber end would break, and then you'd have to hold the mask up. The others, but we've gotten so sophisticated. We're way beyond that nowadays, to go to a party or just to go out and have fun. But well, let's get to a couple questions and then we'll kind of circle back around. But one of the questions we had certainly submitted is if I want to wear decorative contact lenses, which we're already talking a little bit about, as part of my costume, what should I do to make sure they are safe? And we've kind of talked about that and answered that, but let's go through that again. So this is a patient who's saying, certainly I intend on wearing these decorative contact lenses as part of my costume. What do I need to do to make sure they're safe?
Yeah, like we already said, if you go to an eye care provider, that would be the best option, because you can get fit correctly, you can make sure it's a safe lens, can told how to wear it. But another thing, just in general, is to make sure you're not sleeping in any contact lenses. That'll help protect from getting any infections.
Well, unless you have a lens that's specifically prescribed that you can sleep in it, but that's a small percentage. And the other thing, again, the bacteria doesn't differentiate. So you've got to have good antibacterial solution, and use the proper solutions, and soak the lenses properly, and clean your hands when you're dealing with these things. Just some basic things. But you forget, you may have a few libations on your outgoing party activities, and you tend to forget things like that, but you'll pay the price.
And I will say this from wearing contact lenses since I was probably 13 or 14 years old, and I'm wearing them right now. When you get into an environment, if you're drinking alcohol or if you're in a smoky environment, it certainly affects the contacts. They do dry out. There's some negative things that can happen there. So, we want to talk about artificial tears, maybe doing this or that to make sure they're as comfortable as they can be. And the other thing, coming in for our exam, maybe you're an established contact lens wearer and you just want to wear, a special lens for that evening, and you already kind of know how to put them in, or maybe you're a new wearer. Maybe you've never worn contact lenses. We can get you fit, and it's nice to be able to practice, in our office with a pair of contacts. So if you drop it or lose it, we can give you another pair, because some of these cosmetic contact lenses can be a little costly. And if you're trying to put that and you lose that or break that, that can be a lot of money. So, certainly we want to get you practice, get you feeling confident so you don't have any issues when you're going to the actual lens you want to wear to the event or out that evening.
And so you need to think of this in advance, because most of these are custom made. At least all the FDA approved ones are. So you can't come in Halloween afternoon and say, I need these tonight. So we have a very limited stock because we fit with those lenses. But to get a specific Auburn University tiger on that lens and have it match the other eye and do all that, that usually takes at least 2 weeks, if not more. So if you're going to do this, you need to get on the stick.
So going back through tips or hints that we certainly recommend, especially with anything around the contacts or anything around the eyes. Make sure you're washing your hands. Certainly after COVID, we're all doing more of that. Wash your hands, make sure you're sanitary, make sure you're doing all that before you touch your eye itself or anything around the eye. Make sure you're reading instructions of what chemicals, with the costume you're wearing, make sure, it's not dripping into the eye. Make sure you're not going to have an allergic reaction to some of that. Just make sure in general you're just thinking things out versus just going out and having a bad experience. I mean, you read some of these issues, we don't think of so many things that can happen until after the fact, but it seems like after the big holidays for us, 4th of July, maybe New Year's, sometimes Halloween, we're having an influx of patients who are coming in after that holiday with numerous eye-related issues. And we don't mind seeing you, we want to see you, but we'd also would help to help prevent some of those so you don't have to come in afterwards for whatever that is.
As opposed to saying to you, hey, don't worry about it, just come in if you have a problem. That would be unethical and expensive for you.
And we've said this in some of our prior casts. We've got multiple offices. Certainly visit us at TerrezzaOptical.com. That's our website. Find out which office is closest to you. We do schedule out in advance, but if it's an office visit, if it's urgent, you've got pain, you're having irritation, we certainly want to try to work you in as soon as we can. So give us a call, and certainly we have same-day appointments available. If we can't do it same day, we're going to try to get you in as soon as we can to address the issue that you're calling about. So we want to thank you guys. Very quick, these things fly by. Certainly talk about Halloween and everything. From myself, Dr. Terrezza, Dr. Martin, thank you for joining us on this episode.
We appreciate you.
And certainly like our page, visit our website, TerrezzaOptical.com, and if we can help you with just a general eye exam, anything medical related, anything office visit, red eye related, give us a call. Insurance or not, we'd love to have you. Thank you guys.